Hi everyone, I'm Vidit Kapoor and I'm working as an internal medicine resident in the University of New Mexico Hospital in the US. I'm in my second year of my internal medicine residency and I'm here. I've been invited by Education Abroad to share my experience with you guys, and so I hope this will be helpful to you. I'll touch upon the basics right now, and if you have any questions, and you can feel free to write in the comment section, and I can also make another video for you guys if you want. So I think the first step, if you're interested in doing a residency in the US, is to ensure that your medical school is enrolled in the World Directory of Medical Education, which is a list of all medical schools enrolled by ECFMG, that are recognized by ECFMG. And typically the medical school list is available at the ECFMG website, which is ecfmg.org. If your medical school is not listed in the World Directory, then there is also a procedure by which you can have your medical school enlisted in the list. Now the Usmle exams requires a lot of determination and hard work and patience. The Usmle exams, Usmle, so that stands for a United States Medical Licensing Examination. The advantage of giving that exam is these exams are required to so you can practice as a licensed practitioner in the US. So I'm going to start with all the steps. It is a 3-step exam. The first step is called Usmle Step 1. You can take this exam after you've completed your preclinical subjects, including anatomy, physiology, biochemistry, pharmacology, and microbiology. Typically, these subjects are covered in the first 2 years of your medical school, so you can be eligible to take this test in the 3rd year of your medical school. And this test can be taken at your home country. You don't have to go to the US to take this test. It is an online-based, MCQ-based exam. It is usually held at Prometric centers, which are available in most of the metro cities in almost all countries. This test is a long test. It is an 8-hour test, usually comprises of 7 blocks of 40 questions each. You get 1 hour for each block, and you have to answer 40 questions in each block. Some of the resources I used for the test were UWorld. I think UWorld is the best resource that you can use for all your Usmle steps. You should be very well versed with your preclinical subjects, the ones that I mentioned: anatomy, physiology, biochemistry, microbiology. Microbiology is a very, very heavily tested subject in your Usmle Step 1. If you're in medical school, like I know people take this exam in the 3rd year of medical school itself. At that time, if you are doing clinical rotations, if you have a very busy schedule in your medical school, I would recommend giving at least 6 to 7 months. If you're not working, then I would recommend 3 to 4 months. And I personally used 4 months of dedicated study. I was not working at that time. I gave my steps after I finished my internship. The next step is Usmle Step 2. The Usmle Step 2 is also divided into 2 more steps: the Step 2 CK, which is the Step 2 Clinical Knowledge, and the Step 2 Clinical Skills exam, which is also called a Step 2 CS. For the Step 2 CK, people typically give this exam in the first 2 months of finishing Usmle Step 1, because there is a lot of overlap in the topics that are tested in Usmle Step 2 CK and the Step 1. Step 2 CK is more of a clinically based exam, so people also give that exam after they finish their clinical rotations in their medical school. What I did was I gave my Step 1 and then immediately went on to Step 2 CK. I used 4 months for my Step 1 and then 3 months of dedicated study for my Step 2 CK. But I know people also give their CK exam during their clinical rotations while they're doing that in their medical school, typically during the 4th year or their medical internship. Um, you can do it either ways. I think both of them are equally beneficial. If you are doing your clinical rotations, then you can give your Step 2 CK during your clinical rotations. And if you're fresh out of your Step 1, then you can also give it in the first 2 months, within your first 2 months of finishing your Step 1. Now, resources I used for Step 2 CK were, again, the Bible of Step 2 CK is MTB, which is Master the Boards. It is a review book which is written by Conrad Fisher, and you can purchase that online or even at medical stores. The duration of time I used was 3 months, and I wasn't doing anything at that time. And again, depending on how fresh you are from your Step 1, you can give that exam within 2 months of finishing your Step 1. And if you're doing your clinical rotations, I would again recommend giving 6 months of time for your Step 2 CK as well. And the Step 2 CK can be given in your home country at Prometric centers. You don't have to go to the US to give that exam. The next step is Usmle Step 2 CS, which is a clinical skills exam, and this test can be only taken in the US across 6 centers, 2 centers in Philadelphia, 1 center in Houston, 1 center in Atlanta, and 1 center in Los Angeles, and 1 center in Chicago as well. So for this test, you need to go to the US. It is a patient simulated exam. You have patients who are actually actors. They're not actual patients. They come up with complaints. You go in the room where the patient is located, and then you're given 15 minutes to do a brief history and physical exam. You go in there, you ask questions, you do a history and physical exam, and the most important thing is to counsel a patient. So typically what is recommended is you finish your history and physical exam in the first 10 to 12 minutes, and then based upon what your differential diagnosis is, you counsel the patient about what you think is what's wrong with the patient, and what you think should the next steps be in whatever labs you want to order, and why you want to order them. For example, if a patient is a smoker and you feel that his disease could be related to his smoking, then you need to counsel the patient about the importance of quitting smoking. So once you finish all of this in 15 minutes, you go out of the room. Typically outside of the room, you have computers where you type in your progress note, which typically includes your findings, your assessments, your list of differential diagnosis, and whatever test you want to order as a next step. So all this takes 10 minutes. So 15 minutes for history and physical, and 10 minutes to write your progress note. You have 12 case simulations, and you are graded by the patients. You are graded based upon how you interact with the patients, how you counsel a patient, how you explain your findings, and how you write your progress notes, your differential diagnosis, and what tests you order. And then one thing I forgot to mention in my Usmle Step 1 and Step 2 CK, that is a scoring based test. Typically the passing marks for each of these tests is 190, and anything above 220 is considered a good score, and then anything above 230 is considered a very good score. But I know people who also score more than 240s, which is considered excellent or outstanding scores. So once you're done with these steps, the next step would be to get good letters of recommendation. Now the Usmle is, they want you to get good scores, and they also want you to have good clinical skills, which is typically demonstrated by your clinical skills exam and also by the letters of recommendation. Now letters of recommendation is the next best thing that you can do for your application after you get good scores. You typically get letters of recommendation from the dean of your medical school, which is highly recommended because they want you to be in good standing with your own medical school. And then the rest of the letters of recommendation you can get from your US clinical experience. The US clinical experience is another field in itself. I think what I did was, after I finished my internship in my medical school, I applied to clinical observerships, and I worked under US physicians as an observer. Observerships are good because you get to see how US clinical system works, but the advantage of doing but you can also get clinical experience in the form of an externship, and that you can do only while you are in your medical school, while you are doing your medical internship in your medical school. You are typically not allowed to do medical externship after you finish your medical internship in your own medical school. Since I had finished my medical internship, that is the reason why I did only observerships and I wasn't able to do externships. Externships in the US are more advantageous or more beneficial to your whole USMLE application as compared to observerships, because you get hands-on clinical experience in externships, which you are not able to get in observerships. So I would highly recommend that you get in touch with whoever you know. Typically, if you're in a medical school who has a system, students from one medical school are preferred in US universities, and you can typically get in touch with your seniors and see what the system in your medical school is. You can write emails to whoever you're interested in working with at top US universities, and then depending on what response you get, you can apply to clinical externships in US universities. Now this process is a tedious one in itself. Sometimes or many times you don't get responses because the physicians in the US are very, very busy, and that is where contacts come into play as well. Some of the seniors in your medical school would know someone under which they did their externships or observerships. You can typically get in touch with them and then see what physicians they got in touch with in the US, and then write to them and then go there and work with them, typically for a month. That in itself requires a lot of hard work, and then if you're able to impress those US physicians, you can get good letters of recommendation that will help you with your overall process of getting into a residency. Once you get good letters of recommendation, once you work with a good US physician, you can also build more contacts. Once you're in the US system, you can ask them for whatever research they're doing or whatever research you're interested in. Because research, what I did was the US physician I was working under, I approached him for doing research, and I was able to publish 1 or 2 case reports. And I was also able to enroll myself in a retrospective research that I was able to tell in my interviews as well, which really helped me with building a good CV and my entire application for my USMLE. So once you get into your clinical externship, I think that is the first door to your US clinical experience that you can get. And then from there you can build your contacts and get into more externships and more research and case reports like I did. Once you're done with all this, I think a good USMLE application includes good USMLE scores. Of course, USMLE Step 2 CA pass in first attempt, good letters of recommendation, some research experience in the form of 1 or 2 case report publications, and then basic clinical or preclinical research experience. So once you have this, the next step is to actually apply for your medical residency. I was interested in internal medicine, which is considered as an average difficulty level. People also apply to family medicine or pathology, which are considered easier specialties as compared to internal medicine. And then there are people who want to apply for more difficult residencies like surgery and ENT and dermatology, which are considered very, very difficult as compared to internal medicine. So once your application is made, typically the timeline is you want to have your scores and your letters of recommendation and your research experience, everything in by the 1st of September. At the year of which you're applying. And one thing is also highly recommended is that you should be ECFMG certified while you apply for your residency. And that you will be ECFMG certified after you pass your step 1, your step 2 CK, and your step 2 CS. Once you're done, once you pass all these exams, you can typically enter your scores in your Usmle or your ECFMG account, and then within 1 to 2 weeks you will be ECFMG certified. Once you're ECFMG certified, you can apply to your US residencies. The deadline or whatever, what I did was I got ECFMG certified by September 25th or so I applied on September 26th at the year I was applying, but it is highly recommended that you apply on September 15th, because that is the time when they start looking at your applications, and that is the time when they start considering you for giving you interviews. So in order to apply on September 15th, you need to be ECFMG certified by September 15th. And for that you need to have your results by September 1, results of all your exams. And that would obviously mean giving your step 2 CK by July 31, and then allow 4 to 6 weeks so your results can come out. So you finish all your tests by July 15th or July 31, and then you get all your results by August, and then you apply in September. Again, September 15th is highly recommended deadline for applying. And then typically once you apply, you start getting interviews depending on how the program directors of US universities like your application. They send out interviews. Interview season is typically between September and February. Mostly I got interviews in October, November and December. I did not get any interviews in January or February. And then this is the time when you also need to travel a lot depending on the number of interviews you get. Go to your interviews, and then depending on how they like you, they rank you, and that is a process in itself. And then one thing I also wanted to mention was the entire system of application. The entire system is an electronic residency application system, also called as the ERAS system. So once you apply in September, you need to fill out, your application has to be submitted to these programs or to these universities through this electronic residency application system, typically called as the ERAS system. And then again, your application will consist of all the things that I mentioned: your scores, your letters of recommendation, your research experience, and whatever else you have in that. And then you will get your residency interviews through this electronic residency application system. And once you get interviews, you need to travel and then give those interviews. Now, interview preparation is another topic in itself. What I used was I just went online, I looked up what questions they ask typically in those interviews. I also got in touch with some of my seniors who guided me what universities like to ask what all questions. So typically what I would recommend is what they like to ask is what your hobbies are, why you're interested in pursuing a US residency, what your ambitions in life are, how you see yourself in the next 10 years professionally, and what your long-term goals are in this field. And then why you chose internal medicine residency or whatever residency you're applying in, why you chose a residency, and how you would like to use your residency in the betterment of this world. So these are the typical questions that they ask, and you can also go online, and there are a number of websites. You can use usmleforums.com, which is a great forum in itself. They have other resources as well that you can use. And then once you're done with your interviews, your March is the season of match year basically March is the time when they tell you whether or not you've matched. So typically around the second week of March you get an email telling you whether or not you've matched, and then 4 to 5 days after that they give you this email. If you've matched, they tell you what university or what hospital you've typically matched in. And once you have this, and then once you match, and that is typically celebration time, and you need to apply for your visa, and that's the whole process. And I touched upon some basics. There are other things. If you want me to comment upon particular details of processes, then I can make another video. If you have any questions, comments, you can comment in the comment section, and I'll be happy to answer all of your questions. So I'm a second year internal medicine resident at the University of New Mexico School of Medicine in New Mexico, Albuquerque, in the US. I finished my internship in 2014, and I started the process of USMLE after I finished my medical internship. I gave my step 1, then I gave my step 2 CK, and then I went to the US, and then I did 2 or 3 observerships. I did some research in the form of a case report and a review article, which thankfully was published before I applied for my residency. While I was in the US, I also gave my step 2 clinical skills exam while I was doing my observership and doing research as well. And then I came back. I applied from India through the electronic residency application system. And then once I applied to, I think I applied to about 70 to 80 university and community hospitals. And then once I started getting interviews, I went back again to the US, gave my interviews, and then I came back again. And then I got to know that I matched in March 2016. And then July 2016, I was able to start my residency. If you do your MBBS from America, you get preference. I mean, the process of getting into a US medical residency is easier for those who do their MBBS in the US. I wish everyone who's watching this video all the very best in pursuing their USMLE dreams. And if you have any questions, you can let me know.